Mr. Foster, I want to focus on the out-of-pocket costs for Medicare beneficiaries related to the Affordable Care Act and the effect that it has on those out-of-pocket costs. Because our colleagues on the other side of the aisle talk about how they want to reduce costs for seniors, but it's hard to see how they really mean that when we know that the Affordable Care Act, at least by your projections, will actually bring costs down in terms of seniors' out-of-pocket costs. So can you describe in Medicare fee-for-service whether and how the Affordable Care Act reduces out-of-pocket costs for seniors over the next few years?
Sure, I'd be happy to. Under the Affordable Care Act, of course, payment rates to almost all fee-for-service provider categories are reduced. And what beneficiaries have to pay for deductibles and coinsurance are tied to the prices that Medicare pays for the service. So if that price is lower, then the coinsurance or the cost-sharing requirements are also lower. For beneficiaries in fee-for-service Medicare, that makes a pretty big difference over time. And I have the numbers, but not with me, but we have a memo on this subject if you'd like to see it. And the reductions are in the hundreds of dollars per year, so it's not trivial. It's only fair to add that for Medicare Advantage beneficiaries, the opposite is true. Because the payment rates are coming down, that means the extra benefits that plans have been able to offer are also going to come down, and that means that the beneficiaries or the enrollees will have to pay more out of pocket, and that can also be in the hundreds.
But right now, all Medicare beneficiaries are paying for those benefits that Medicare Advantage beneficiaries are receiving, and so would the costs for non-Medicare Advantage beneficiaries be reduced as a result of that shift?
Yes, the Part B premium in particular is roughly $4 a month higher than it would otherwise have been because of the higher cost associated with the law for Medicare Advantage plans prior to the Affordable Care Act.
So in Medicare Advantage, you have Medicare beneficiaries who may well be benefiting from extra programs and benefits, but you have people who aren't getting those benefits paying for it.
Yes, although there's different numbers of people, so the extra benefits are typically worth far more than the $4 a month that everybody has to pay in addition. Now, that's a policy issue. What you do about that, the law's already been decided. That will change over time. But your main point was that for fee-for-service beneficiaries, their out-of-pocket costs for premiums and cost-sharing requirements are coming down. For Medicare Advantage enrollees, they're going up.
The numbers that I've seen, and let me, if you remember these or if you can confirm their accuracy, Part B premiums would decline by more than $200 per beneficiary by 2019. Coinsurance declines by more than $200 per beneficiary on average by 2019. And while Part D, the prescription drug beneficiaries, will see a slight increase in premiums, those are substantially offset by the closure of the donut hole, which saves the average senior, I know in my district, more than $3,000. Is that about right?
For people affected by the donut hole, that's right.
Right. Okay.
And I just want to emphasize those are annual figures.
Yes.
Not monthly.
Oh, yes, right, of course. But it's still, I mean, when you're living on a fixed income, several $100s a year is a big deal. I mean, I have the women in my district who are seniors are living on about $12,000 on average a year total, which so a few $100 matters a lot. Mr. Goss, just really quickly, I only have a minute to ask you this question, but the Ryan Republican roadmap released last year that would have proposed setting up private accounts by diverting Social Security payroll taxes. What was your estimate of the cost of diverting those payroll tax contributions, and also how would that have impacted benefits?
The design of the plan was that Chairman Ryan put forth was to offer an option to individuals to accept a scaled amount of money going into personal accounts, and the offset to that was that they would be giving up on a portion of the benefits going forward. So it would be an option for individuals. It
would have been a reduction in benefits?
Well, there would be the design of the plan, there would be a reduction in the general scheduled level of benefits overall under Social Security by altering the primary insurance formula, especially for higher income folks.
As I said, as my time expires, when you only have about $12,000 available to you all year, any benefit cut is a serious impact on your life, and another example of how privatization of Social Security would be irresponsible. Thank you, Mr. Chairman.
Thank you.
for that.
Since